This is Laurent Spelle speaking. We are at LINNC Paris 2023 and we are here to discuss the CLEAR study, and we have two important guests who are involved in this study. First of all, we have Raul Nogueira from Pittsburgh, United States. Hello, Raul.
Hello, Laurent. Thanks for the invitation to be here.
And we have also Serdar Geyik from Istanbul, Turkey. Hello, how are you, Serdar?
Hello, Laurent. Good to be here.
So we would like, first of all, to just remember everybody what was the design of the CLEAR study. Raul, can you just brief us about that?
Sure. So the CLEAR study was a prospective, multicenter, single-arm trial that was recently conducted in the United States with the objective of getting FDA approval of the NeVa device that has now been used in Europe for quite some time with good safety and efficacy results. But as you know, we need those type of prospective data in order to get 510(k) clearance in the United States.
So, Serdar, do you have any comment about how many patients were included in this study, where they were coming from, what was the inclusion criteria for those patients?
As Raul mentioned, it was a prospective multicenter and multinational study. Almost, it included like 140 patients. Some of them was excluded due to protocol deviation, but intention to treat at the end of the study was intention to treat, and it was 107 patients included. It was almost the same protocol used with the other studies, like age between 18 to 85, and they covered the onset 8 hours from the onset time, and then it has applied a strict core imaging, like below 50 cc of the DVI or aspects higher than 6. That was the target point, and mostly the location included M1 and M2s.
So now, very important, what was the primary endpoint findings?
So I actually think it's always an important discussion to have in single-arm trials. I never really like to look as much into functional outcomes, because that depends a lot on the population that you study, their age, the baseline aspect score, baseline NIH. There are so many factors, right, that will define your functional outcomes at 90 days. But the angiographic outcomes tend to be a little more comparable across different studies, and that's really where the CLEAR study stood out. So the rates of first pass reperfusion to a TK2B or 3 was essentially about 75%, so 3/4 of the patients. In terms of first pass full reperfusion, a TK2C3, 49% of the patients, so half of the patients single pass full reperfusion. And when you look at the final results just with the NeVa device, 95% of the patients had TK2B or 3. So it is a device that has very high recanalization results, right? And a lot of this may have to do with the very unique design of this device, with these drop zones where all types of clots, not only those more erythrocytic, softer clots that tend to go through the struts of regular stents, but also those harder, firmer clots that typically don't get incorporated by the struts of other stent retrievers. They may roll and then fall inside these drop zones and be captured by the stent. And the device is actually now getting an add-on of a distal filter that may even improve upon these angiographic results that we just discussed. And this is something that you are currently evaluating in terms of bench models to prove that you have less distal embolization with the addition of this distal filter. But I really think that's where this device stands out. It's a very high rates of first pass reperfusion amongst the highest we have seen with stent retriever technology.
So fantastic results with a large amount of patients. Serdar, what about the safety of the NeVa device?
Well, the safety endpoints were all reached out. Compared with the other studies, there was no higher risk of 24 hours subarachnoid hemorrhage or 30-day mortality or 90-day functional outcome. Those are all in the safety margins.
And what do you think was the impact from the device on the outcome? Do you have any explanation for the LINNC online followers? Do you
I
think
would
that
say, if you agree, faster recanalization, better recanalization, and then easier recanalization, I would say, because the average duration of time for the procedure was low, like 30 minutes, and then first pass excellent recanalization rate is high, and then the 1 to 3 pass primary endpoint is significantly high compared to the other studies, and the total recanalization rate in the small duration time is high.
I fully agree with that. Another thing that it's important to remark is some studies, they mandate the use of a balloon guide catheter in the anterior circulation. This was not the case with the CLEAR study. Maybe it's up for a debate for certain people, but I think there is a lot of data about greater use of balloon guide catheter leading to even better results, and here the utilization wasn't very high, so these results could even be potentially better, but they are still amongst the best.
There is two ways of thinking. Either you think that finally you have very good result with the NeVa without the guiding catheter, or you may expect having better result if you use, but for sure here the results were obtained mostly without the balloon guiding catheter, which is probably something in relationship with the NeVa device. So Serdar, how would you now implement the usage of the device in the daily practice? Is that the tool that you should use immediately, or the salvage tool or rescue tool?
We have been using this device out of the study as well for the last 4 years. Maybe we have 500 cases totally reached out. So I can easily recommend you can use it as a first-line therapy, and then if it has failed, you can use it as a rescue therapy as well safely. Mostly I would recommend the ICA tips. It's very effective in the ICA tips as well as in the MR. Everyone can use it as a baseline.
So just to conclude, the CLEAR study is providing tremendous high rate of first pass recanalization with a safety which is very good, and is probably due to the design of the device, keeping in mind that most of the cases they were recanalized without the usage of a balloon guiding catheter. So Serdar and Raul, thank you very much for this comment.
It's been a pleasure.
Thank you. Thanks, Laurent. Thank you.